Good afternoon, everyone. Here for the Joint Task Force, Doug McGowen, Chief Operating Officer for the City of Memphis, and joined by Dr. Michelle Taylor from the Shelby County Health Department. I'll be brief this morning, talk a little bit about our vaccination campaign and some of the changes that you recently saw with the authorization. And then I'll turn it over to Dr. Taylor for some updates on the state of the pandemic. We have continued our door-to-door campaign to get people out. We were in 38141 recently, visited about 350 homes last week, and we have visited more than 30,000 homes since we started this work in May. We've also spoken with 61,000 individuals in our more than 100,000 phone calls that we've made through our phone bank, and we think we're getting results to get information to people to come out and get vaccinated. There is some changing to the schedule that you will see because of the Veterans Day holiday next week, which is Thursday. Two changes I'd like to call your attention to. First, we'll do this joint task force briefing on Wednesday of next week instead of Thursday so that we can recognize Veterans Day. And because of that, the Pipkin drive-through site will be open on Monday but will be closed on Thursday. All of that information can be found on the website. We'll have that updated information for you. So again, Pipkin will be open on Monday the 8th. But closed on Thursday the 11th, and we'll be back here for the Joint Task Force briefing next Wednesday. You heard that Shelby County has begun immunizing 5 to 11-year-olds, as have several partners around the state and other private clinics here. And I'll let Dr. Taylor talk about the operation that's happening today and even right now at 814 Jefferson Street. That is our first location for public vaccinations of the 5 to 11-year-olds. There are 42 authorized providers around Shelby County. Not all of them are offering vaccinations yet for a couple of reasons. First and foremost is that not all of them have received their shipment of the pediatric dose of vaccine. We have about a third of them who have received their dose. The rest we expect to get those doses either today or tomorrow. So by about early next week, we should have most of the providers who are authorized to do those pediatric doses available, and that is Walgreens, Walmart, CVS, and the other private clinics that you might have been to before, and also some of the pediatric offices in and around Shelby County. One thing that we will not be doing in the immediate is vaccinating 5 to 11-year-olds at our public drive-through sites. Now, there are several reasons for that. Most of them have to do with safety. First, the drive-through sites are a dynamic place where there are cars moving, and 5 to 11-year-olds will likely have to step out of a car, and that puts a little bit higher risk, especially for kids who may be frightened of getting a vaccination. The second is that the pediatric dose, you will remember, is different than the adult dose, and having both of those side by side being administered at a public drive-through adds to the complexity and increases the possibility of an error. And we want to avoid that as we get started with the 5 to 11-year-olds. This is a very different approach to vaccinations. And third, it depends on the type of syringe and needle that we receive in the ancillary package. There are different procedures depending on the syringe that we receive. Just very simply, if it is a slightly longer needle, that vaccination for a 10-year-old and under needs to go in the thigh. If it's a shorter needle, then it can go in the arm. But we will not know until we receive those ancillary kits which syringe we have. Clearly, if we have to do it in the thigh, a drive-through site's not appropriate for privacy, and we'll have to do that in a clinical setting. That's why pediatricians' offices, the pharmacies, the Minute clinics, and the Shelby County Health Department clinics are appropriate for that. Now, to help in the effort, the City of Memphis, in coordination with University Clinical Health and Methodist Le Bonheur, will host clinics at 2 city community centers. They will be at the Glenview Community Center and the Hickory Hill Community Center. Those will be held on Friday the 12th of November, Saturday the 13th of November, and they'll be held on Friday the 19th of November and Saturday the 20th of November. The hours of operation will be 2 p.m. to 7 p.m. on Friday. We're trying to do after hours, so there's some availability after school hours. And then on Saturday, they'll be open from 9 a.m. to 2 p.m. That's again the 12th and 13th of November, 19th and 20th at Glenview and Hickory Hill Community Centers. Those are a nice complement geographically to the 814 location, the 814 Jefferson location for the health department. So just a quick recap. Today you can get your 5 to 11-year-old vaccination at 814 Jefferson at the health department. And on those 2 coming weekends, we'll have some additional public capacity to vaccinate children at those locations, in addition to the 42 private locations around the city. So with that, I will turn it over to Dr. Taylor for some data on the pandemic and additional words on how it's going at 814 Jefferson.
Good afternoon, everyone. I'm going to run through some slides as usual, and then we'll talk about how vaccines are going today. Total COVID-19 cases reported today, 146,296. New cases reported today, 84. That is down from 109 cases reported this time last week and 102 cases we reported 2 weeks ago. The overall trend in new cases appears to be trending downward. The 7-day average of cases per day is 84. The 7-day average has also continued a downward trend, down from 91 this time last week and 114 2 weeks ago. We continue to see a downward trend in active cases in every age range, including pediatric cases. Today, we report 20 new pediatric cases and 246 active pediatric cases overall, down from 282 last week and 326 2 weeks ago. Next slide. The 7-day average test positivity rate is now 2.8%, which is down from 3.6% this time last week and 6.8% 2 weeks ago. The lowest positivity rate for tests we have seen during the pandemic was 2.3% back on June 21st, 2021, so we are getting close to that record. Next slide. The effective reproductive number, or RT, of the virus is now 0.83, a slight increase from 0.77 reported last week, but still below 1, meaning that we may be about to reach a plateau, but that the transmission rate is still decreasing in the community. Total COVID-19 hospitalizations today are 93, with 29 in the ICUs and 64 in acute care. Next slide. This chart shows the confirmed cases per 100,000 population for the areas surrounding the Memphis metro area. As you can see, Shelby County is the lowest curve in blue. Next slide. When you compare Shelby County to other metro areas in Tennessee, Shelby County has 9.3 cases per 100,000, a 2.8% test positivity rate, and 45.9% fully vaccinated. In comparison, on this slide for Knox County, you can see Knox County has 13.6 cases per 100,000 and an 8.5% test positivity rate, while having 54% of their population fully vaccinated. Next slide. When you compare us to Hamilton County, we have 9.3 cases per 100,000. Hamilton County has 11.8 cases per 100,000 and a 7.1 test positivity rate, and 50.6% of their population is fully vaccinated. Next slide. And finally, when you look at Davidson County, which is the Nashville metro area, they have 13.6 cases per 100,000 in comparison to our 9.3, with a 6.8 test positivity rate in comparison to our 2.8% test positivity rate, and 57.7% of their population is fully vaccinated. Next slide. This slide just shows what I talked about. Every other county that I have mentioned has a higher vaccination rate than Shelby County, but they also have higher case rates per 100,000 than Shelby County. Next slide. when you look at active cases by age, you see that while cases continue to trend down across every age group, the percentage of the active cases among the 0 to 17 age range has actually increased to 28.1% of all active cases. This supports the continued masking in schools and vaccination of children 5 and older, now eligible for vaccination. Next slide. And this bar graph shows the same thing, where you see decreases across all age groups. But remember, of our active cases, 28% are still children. Next slide. This map shows active cases by zip code. You see that zip codes 38002 currently have the highest concentration of active cases in Shelby County. Next slide. And active pediatric cases are concentrated in the zip codes that are in the darker blue. Next slide. Regarding vaccinations, this chart shows the first, second, and third doses by date, with the third doses in darker blue. Our goal is to increase the number of first and second doses in order to meet our vaccination goal, and of course, as you know, children 5 to 11 are now approved for vaccine, and that should also get us closer to our goal. Next slide. The goal is to have at least 70% of the population fully vaccinated, and that's a goal that was set early on in the pandemic and early on in the period of time when we first had vaccinations. You see, we are more than halfway there to our goal, but we still have a long way to go. That's the end of my slides. As Chief McGowen shared, the Health Department is offering the pediatric Pfizer COVID-19 vaccination for children ages 5 to 11 at its immunization clinic at 814 Jefferson each Monday through Friday from 8 a.m. to 4:30 p.m. Other providers will begin offering the pediatric vaccines very soon, as shared by Chief McGowen, including the large pharmacy chains, some clinics, and some pediatricians' offices. Please check with your private offices, if that is where you would prefer to go, to see if they will have those doses available. And if not, please know that the Shelby County Health Department, along with our trusted partners, will be available to give those pediatric doses. The best way to find a vaccine provider near you is to go to Vaccines.gov and enter your zip code. And with that, I will take your questions.
Brad Broders, ABC 24.
Thanks, Dr. Taylor. As always, a perfect segue into my first question. I know today's the first day. I want to be fair here, but I'm already hearing from some parents concerned about the offerings only basically within school or work hours at the health department. When do you ideally hope that the public sites could be expanded into the weekends or having additional public options for those parents? And I have a follow-up.
Fabulous question. As Chief McGowen shared, we have been having ongoing conversations with other providers in the community that are waiting for their doses, and so that will become an option. We know that folks have to go to work, we know children have to go to school, but we also know that there are some parents who will be able to take the privilege to take time out to come down and get vaccinated. With that said, those offerings on Friday and Saturdays that are coming up being offered by the City of Memphis and Methodist Le Bonheur Healthcare are going to be a welcome addition to what we are already doing at the Health Department.
Thanks, Dr. Taylor. And as a follow-up, do you have any kind of idea of the weekly doses that will be available to that age group? Is there any kind of special amount set aside for them? And are you confident this first couple of weeks there'll be enough doses to meet the demand?
I'm confident that there will be enough doses to meet the demand, first of all. Like Chief McGowen shared, there are several providers who have already ordered their doses and are just awaiting shipment, and some folks have received their shipments. So with us, City of Memphis, other private providers in the community, as well as the big box stores, there should be more than enough to meet the demand. And I will tell you, in case you have another follow-up, since 8 o'clock this morning, as of 11:30, when I was leaving 814 Jefferson, we had given 50 vaccines already to the 5 to 11 age group.
Michaela Watts, Commercial Appeal.
Hi, good afternoon, everyone. I have a pair of questions for Dr. Taylor about the overall state of the pandemic. And the first one is, with what we know about current hospitalizations and this declining curve of new cases, is it fair to say that we've seen the majority of deaths from that Delta variant surge? Are we on the other side of that? And I'll have a follow-up.
So, great question, Michaela. I think it is fair to say that we are on the correct side of the surge. We still are mostly seeing Delta if people are infected with COVID. There have not been any predominant new strains that we've seen in Shelby County. With that said, we still are telling people that COVID-19 is still very much in our community and that they should be protecting themselves with masking and vaccination when at all possible.
Thank you. And you kind of partially answered my follow-up question, which was going to be if there are any new variants, not necessarily in Shelby County, but if there have been reports of any new variants that we should keep our ears tuned towards, just in the United States in general.
The last variant that I heard about, and this was about a month ago, was the Mu variant, which I don't think was as serious in the U.S. as many were afraid that it would be. But with that said, we've had this conversation many times before. Viruses can come up with all kinds of new variants if allowed to remain unchecked in a community. And so that's why it's so important that people are masking and getting vaccinated so that we can keep those transmission rates low and we can keep the probability of new variants coming on the scene low.
Abigail Warren, Daily Memphian.
Hi, I wanted to see how your approach, I guess, will change with the bill that the governor has on his desk.
Well, what I will tell you is that our approach will remain the same. We will continue to fight to protect and promote the health of every Shelby County resident. And the only thing that may change is if the law does go into law, becomes a law, then there will be some decisions at the local level that will have to be passed through Nashville for approval, especially during a pandemic. We know that, and we have seen the fruits of our labor just from the numbers that I shared. When you compare us to Hamilton County, Davidson County, and Knox County, we know that some of the mitigation efforts that we've put in place here, mainly the masking in indoor public spaces and universal masking in schools, has made a very huge impact, because when you see that our case rates are lower in spite of having lower vaccination rates in Shelby County, then it tells the story about how important it is to really look at local data, have local officials be able to make the call, because we are the ones who live here, we are the ones who are dealing with what's going on in the ground, and it's very hard for somebody in Nashville or any place else that doesn't live in this area to understand what we have to do and the calls we have to make when it comes to public health.
Okay, and then my next question is about the most recent health directive. I've had several people ask, there are no capacity limits in that health directive, are there?
There are no capacity limits, and actually with these latest mask requirements, the one that was recently lifted and the one that's still in place, we have not put any capacity limits in place.
Julian Paras, Fox 13.
Hi, good morning, everybody, or afternoon. I wanted to ask, so you mentioned, the big thing for today is that kids are getting vaccinated now, and you mentioned some steps that are moving in that direction, but what would be the next focus for you guys? By chance, for example, maybe reaching out to schools, asking them if they would be able to possibly vaccinate kids at those school locations?
Great question. We talk to school representatives and leaders every week, and I'm sure that if the different school districts are interested in doing something like that, we will be having those discussions, and if there are any updates to those discussions, I will definitely let you know.
Okay, and then finally, for kids that might be homeschooled or, you know, their families live in more urban areas, somewhere maybe in like Orange Mound or something like that, how accessible would the vaccine be for those types of folks?
Well, that's why Chief McGowen announced what he announced. We are really looking at a community center approach, taking into account the uniqueness of the 5 to 11 age group and how the vaccine has to be administered, and also making sure that parents have the accessibility that they need. So all of those talks are ongoing. We are firming up those plans, and like he announced, starting on the 12th and 13th and the 19th and the 20th, those two community centers that he mentioned are going to be there for parents to start to get their kids vaccinated. We will look at other areas in the future to try to add on that capacity, but just know that we've considered all of that in these planning stages.
Hannah Grabenstein, MLK 50.
Hi, I have a question that I don't mean to ask prematurely, but I've just been wondering it because the last time that we were on this side of a major curve, you know, we sort of stopped with the press conferences unless things got worse, and then things got worse again. And I'm just wondering, are there any plans to, like, are we just gonna, is this indefinite? Are there plans to stop with these kinds of things, the mask mandate having stopped? You know, I'm just wondering, are we like emerging, or what do you think about that?
Great question, Hannah. I guess you all are tired of seeing me and Chief McGowen on camera. So what I will tell you is that for right now, there are no plans to stop. With that said, we know we're going into the holidays. We know that with people gathering, we will continue to start looking at the numbers even more closely than we already do daily to make sure that we're not seeing any clusters or outbreaks that we need to be concerned with. And so if there are any changes in the schedule, we will be sure to let you know. But for now, we're going to stay the course and make sure that Shelby County stays informed.
Thank you. And no, I am happy to see you every week. I was just wondering. And then my other question was, I asked this a couple weeks ago, and I think the answer was like, we're still figuring this out. So I just wanted to see if there was an update on the mobile vaccination, if the concierge vaccination service where people can call and request vaccines at their doors is either still ongoing for adult vaccines or applicable also for child vaccines.
Great question. So I know that the City of Memphis's Health Navigator program is still going on for some of our homebound and elderly residents in the county. And I will also tell you that the Shelby County Health Department is gearing up and staffing up to be able to have what we're calling a mobile strike team to do some of those concierge services as well. So more to come.
Brad Broders, ABC 24.
Thanks for the bonus question, Dr. Taylor. Just twofold question. Do you have any rough ballpark of how many doses between the private and the public sites will kind of be on average in the weeks ahead? And second part, has there been any potential, if the governor signs it, any discussions of legal challenges to some of these bills that have been passed in the legislature?
Oh, wow. Those questions couldn't be any more different. So first one, how many doses? I'm not quite sure a grand total, but we can try to get that number for you. And then on the other side, of course, we have some pending litigation around masking in schools. But as far as legal challenges to the law that has been proposed, until it's signed, we'll have to wait and see what actually makes it into the law before any challenges could occur.
Ariana Poindexter, WMC. Ariana, I believe you're self-muted.
You guys hear me now?
Yes.
Sorry about that. Good afternoon, everybody. I had a quick question regarding the federal vaccine mandate. Do you guys have any comments? I know that it's been announced that the deadline has been pushed back to January 4th. Is there any comment regarding that on behalf of the Shelby County Health Department?
So the only comment that we have is that until we get more guidance on what that's going to look like and what the rules will be through, I believe, OSHA, we can't really say how we will be able to support that federal law. What I can tell you is that we have all 3 vaccines for adults 12 to 17 available at the Shelby County Health Department, and of course we have the Pfizer vaccine available to 5 to 11. So for those who are waiting for that impending legislation and rules out of the federal government, if you've decided that it's time to go on and get vaccinated, then there are plenty of sites across the county where you can get this safe and effective vaccine.
Thank you.
Julian with Fox 13.
Thank you. Just one more question. For the parents that might feel a little uneased about bringing their kids in for a vaccine like this, what would you say to them to calm their nerves, per se?
So what I would say is that this particular vaccine has been through some of the most rigorous safety trials to date of any vaccine. The other thing to remind people is that some of the safety trials were actually done locally here at St. Jude Children's Research Hospital. And so I'm pretty sure that most people in the county can agree that we have one of the world's premier research hospitals here. And if they were willing to do safety trials and have people from our community participate in those trials, please know that this vaccine is safe, it's effective, and it will help to reduce the chance that your child will get COVID-19. Remember that we're still learning a lot about infection with COVID-19 and the long-term consequences of being infected with COVID-19. So if we know we can prevent that in the majority of our children who get the vaccine, why wouldn't we do it? I know parents have a lot of decisions to make about their children, but when they are putting them to bed at night, the most important thing they want to know is that their child is safe from harm and safe from illness. And so the COVID-19 vaccination for ages 5 to 11 is one of those ways where we're going to make parents feel even more safe that their children are going to be well and be healthy.
Abigail Warren, Daily Memphian.
I just have a quick question. Is there any talk about possibly when teachers got vaccinated, some of the vaccine sites were designated for teachers only certain days? Is there any chance that some of the sites might do that again for boosters?
Great question. So nothing is off the table, and it really is going to depend on demand. Right now, we have 2 great large vaccination sites, one in Germantown, one in Whitehaven, both operating 2 days a week, and they're seeing steady volumes. So for now, anybody who wants to get a booster shot, in combination with those large sites, the private providers, and us at the Shelby County Health Department, I haven't really heard that there has been any strain on capacity, but there has been a steady flow of people getting those boosters and getting them on demand when they want them.
We are out of time. Are there any closing messages today?
The biggest message I can give is that now the eligibility criteria for the COVID-19 vaccination as of today in Shelby County is down to age 5. And so if there is anybody in your family, or if it is you, that has not taken advantage of being vaccinated yet, please do so. For those parents who are ready to get their children age 5 to 11 vaccinated, or those parents who have been waiting to get their children age 12 to 17 vaccinated, now is the time to do it. We want to continue to have a safe in-person learning environment for the school year, and this is just another step for getting there. So remember, continue to mask up, continue to make sure that you and everyone in your family and your community is vaccinated, and continue to let us know what else we could be doing to help you. Thank you. And Chief McGowen wants to speak.
Thank you, Dr. Taylor. I don't typically come up after she sums up so nicely, but there was one key piece of information I wanted to share. And I appreciate the question about accessibility. You know, as we normalize vaccines, more sites will be available and proximate to where people live. But we have wonderful partners here who have funded the opportunity for a free ride to and from vaccine. There are 2 ways that you can get that. First, you can go to 222-SHOT. That number still works, and you can request a ride to a vaccine. Alternately, we have 901 Ride Choice. Dial the number 901, the word ride, 901. 901, ride 901, and that is a free ride from your home to a vaccination site and back to your home. So if you're a parent and you have a child that you would like to get vaccinated, you'd like to go to any of the locations we mentioned, they are all eligible. They will come to your house, pick you up, and take you back home. I will also say that we are taking a bit more care with this 5 to 11-year-olds before we do this, before we expand the offerings in the public. 5 to 11-year-olds, as I know Dr. Taylor will tell you, they are not just small adults. These are children, and their physiology is very different. So you have to take a little extra measure of care when you're doing them. That's why we're being conservative in our rollout. We're having special dedicated locations for those vaccinations so that we can pay that extra special care to those children as they get vaccinated. So I encourage you all to take advantage of that opportunity. And to the point about special boosters, as Dr. Taylor said, today we have no plans for any dedicated booster sites. The Pipkin building is offering all of the variants of vaccine and boosters that are authorized, and we're seeing a significant volume of boosters being administered there. So we have lots of capacity. I would encourage you all to stress us there. I'd love to have nothing more than have to expand the hours because we have so much demand, but we just quite frankly do not. So come on out, get a booster, get your first or second shot, and we'll get through this together. Thank you.
Thanks, everyone. We'll see you back here next week on Wednesday.